Hi guys, my name is Amber. I'm the ED Trauma Specialty Educator. Today we're going to talk about how to set up an art line, how to prime your tubing, and how to attach it to the monitor and zeroing the art line. So first thing we're going to start with is what supplies you'll need. So for supplies, ideally we want to prime art lines with 500 ml bag of normal saline. So you'll need your normal saline. You'll also need a 500 ml pressure bag. Next thing is you're going to need your transducer tubing. Comes in a package that looks like this, but your transducer tubing actually looks like this when you open up the package. Very important that you don't throw away this little package that's on the inside. You're going to need these white caps here to replace some of the caps that are on the line after we're done priming. So very important you don't throw this away. We're also going to talk about adding on a vamp to the end of our art lines, just so it's all set up. This is what a vamp looks like. This goes on to the end of the art line. Most of our patients that are getting an art line are going to end up in the ICU, and this is very helpful for them if it's already on the line when they go. The next thing you're going to need is your pressure cables, and this will attach to the monitor. The pressure cable is red to red, so you'll attach the red end to the red part of the monitor. Oh, last thing you're going to need is your transducer holder. You can simple, quick, just screw it on your IV pole. So that's what you're going to actually need when you level it to the patient's venous gas. Now we're going to talk about priming the line. So first thing you're going to do is open up your transducer tubing. Technically, when you're doing this, you want it to be kind of as sterile as possible. So make sure anytime that you're going to take the ends off or the caps, that everything is kept super clean. So this is what it comes out like. So here, this little blue tab is actually called your fast flush device. And in order to start priming the line, we have to get all of the air out of our bag first. So before we attach the tubing to our bag, I like to go ahead and make sure my roller clamp is shut off to the line and that the stopcock here is actually shut off to the patient, because this is the portion of the line that's gonna attach to the patient. So we have that there. We're gonna go ahead and actually spike the bag. So here's our 500 bag of normal saline. Pull the cap off. We're going to go ahead and spike the bag. Now, it's been practiced in the past to spike and then respike the bag to get the air out. But we're going to actually show you the proper way to get the air out of the bag without respiking. But you do need to get all the air out of the bag. So our bag is spiked. The last thing I want to show you is just if your facility has a vamp, to go ahead and add that onto your line before you prime it. So you're going to take your vamp out. This is what the device looks like here. This is the patient end. So the end with this little port, that's where the blood sampling comes from. So if you always think you want that to be the closest thing to your patient, that's how you know you're putting it on the line right. So you're gonna go ahead and carefully remove this cap here on the art line, and you're gonna go ahead and just screw this in. So now everything is all set up, our art line has a vamp on it, and we're ready to actually prime it. So the first thing you're going to do is go ahead and put this into your pressure bag, like so. And we're actually going to go ahead and inflate the pressure bag. I'm going to take this over to the sink because it's going to make a mess, so it's easiest to do this over the sink, making sure that everything is kept very clean. It's going to take just a second to inflate this bag. Okay, so now we're going to actually prime part of our tubing, but we're actually the first step is to get the air out of the bag. Remember, we didn't spike and respike the bag to push the air out, and it's very important we do get all that air out. So our stopcock is off to the patient line. Our bag is primed, and it's pressurized to 300. So in order to get the air out, the easiest way to prime the first part of this line is to go ahead and invert your bag. Sorry, might be hard to see. And then you're just going to go ahead and, it's kind of tricky, but you're going to activate that fast flush device. So you're just going to pull here on the tab. Might help if you open the roller clamp first, then you know that you're actually going to have fluid coming out. And just go ahead and activate that fast flush device. And all of that air, Perfect. Do you guys hear all the air come out of it? So that cap we leave on, that's an air vent cap. And really, we're just priming that first section of our line. We don't have any more air in the bag. So simply by pulling the fast flush device, shutting off the stopcock to the patient's line. That's how we're going to remove the air from the bag. So we primed the first section of our line and we got all of the air out of the bag. Now we need to prime the remainder of the line. So easiest way to do this is to go ahead and put your transducer into the transducer holder. Sorry, I'm doing this left-handed and backwards. There we go. The way you know that this points up is this is actually the cable that connects to your pressure monitor, and this is always going to be pointing up. So we have that in the right position. We're going to make sure our stopcock now is open to the line. When we primed the first half, remember it was shut off. Now we're going to turn ahead and make sure that is actually open now. So we have the remainder of our line to prime. We have another stopcock here on the bottom. This continues to go to the patient. So I have the stopcock shut off to the patient. We're going to prime this little section and make sure we get all the air out of this little cap before we open it to the rest of the line. And how we're going to do that is just go ahead and hold it. It's off to the patient, and we're just going to activate our fast flush. And you'll see the water coming out of that air vent. If there was any air in there, you might hear the air coming out of there as well. So now we're going to prime the rest of our tubing, which has our vamp on it. We're going to go ahead and open that back up to the patient's line. And here we have our vamp connected to the end of this. To prime the vamp, we want to make sure that bit is actually pushed all the way down. You can activate this device by squeezing the sides, and you can pull this up or you can push it down. But we want to make sure that it's pushed down for priming purposes. And we're just going to go ahead and hold this, and we're going to activate that fast flush to prime the rest of the line. Awesome. So this looks perfect. You don't see any air bubbles in here, and we've primed all the sections of our line. The last step is, I'm going to go ahead and move this back over here. So it's over by my patient. We're going to go ahead now that this is all primed and ready to go, and then we're going to carefully hand this end to the doc or whoever's putting in the art line, and they're going to attach this into the patient. So remember how we talked about these white caps that were in the package? Don't throw these away. You're going to need to actually replace the little air vent caps that were on the line. So you're going to take your white cap, this air vent, this is the vented cap that comes on the line for priming. We're going to take that off and go ahead and put this one on. Okay, so we have our art line completely primed. I've taken it and replaced the caps with the white caps and made sure the stopcocks are all open to our line. Also, it's a good idea to just make sure you go ahead and label your lines just so there's no confusion. We know this is an art line. Go ahead and label it. So the next thing is you're going to need to take your pressure tubing. It connects end to end with the top of the pressure tubing on the art line, and then you're going to plug it into your monitor, which is, it says pressure. So go ahead and plug that in here. Maybe. Sorry. Oh my God. We can edit this though. Okay. Takes a little bit to plug it in. All right, so go ahead and turn on the monitor, and we should see the art line pop up. So that all looks perfect. The next step in setting up an art line is making sure that it's calibrated or zeroed you have to zero it to gravity to be able to have an accurate reading. So in order to do this, you need to do a couple important steps. The transducer here needs to be level with our patient's phlebostatic axis, which is basically the fourth intercostal space to the right of the sternum. So kind of just think about their heart, leveling it so it's level to their heart. So you can, some places have they actually have a level. You can lower this here and make sure that it's level to your patient. In facilities where they're transporting patients, via flights or EMS, sometimes I see them actually tape the transducer to the patient's chest. So we have it level to our patient. Now we're going to go ahead and zero it on the monitor. Now in order to do this, we're going to shut off the stopcock to the patient, so it's off to the patient. We're going to go ahead to our monitor, click on our monitor here. If you just, let me do that again. If you just click on the waveform, you have all these options that come up. So we're going to push the one that says 0 ABP, but we're not going to push that until we actually remove the cap. So we're going to very carefully open this line up to air. So we're going to remove the cap here. So now our line is open to air. We're going to go back to the monitor, and we're gonna push 0 ABP. And you will hear it when it's done. Perfect, so it's 0. Carefully replace the cap. And then go ahead and open this line, open the stopcock so it's back open to the line. Now, with the monitor, we don't have, this obviously is not connected to a patient, so we're not getting any waveforms, but you can do a fast flush test and it will work still. So you're gonna go ahead and pull that fast flush device, which is that blue tab, and you should see a waveform. And that's called a fast flush test, so we can talk a little bit more about that at a later time. A few tricks with the art line. If you go ahead and push the monitor here, you can, you can change the scale. If your art line isn't getting a very good reading, maybe that it's over dampened or flat, and you've checked all the things, the line is not kinked, your bag is pressurized, it's attached to the patient. Sometimes you need to adjust the scale. So you can click on scale and you can adjust the actual size of the wavelength itself. It's not connected to a patient, so we can't really see that. Anytime that you're going to be moving your patient, if you're transporting them to CT imaging, if they're sitting up in bed, you need to recalibrate and re-zero the line to get an accurate reading. So that is how you set up art lines. Go ahead and go to your independent skills stations and have fun. Thanks.